Welcome to the Friday Focus. My name is Dr. O from E&S Orthodontics. And today what I'm going to be talking about is one of my favorite topics, and that is orthodontic treatment in young children. It's something I'm really passionate about, and I wanted to highlight a couple things for you so that you can identify for you or your child any type of concern that would require you to come and see us. And so what I wanted to do today is really discuss your dental health care team and my role in it. And what I wanted to do is your dental health care team is comprised usually of 5 people. It's a dentist, your pediatric dentist, and then you have an oral surgeon, you have a root canal specialist, you have the orthodontist, and you have the periodontist. And as a member of your dental health care team, I am responsible for making sure that all your teeth are straight, that you have a great smile, and really most importantly, I'm also responsible to make sure that your top jaw and your bottom jaw grow together appropriately. And so what I wanted to do today is really talk to you about what is normal in a 7-year-old child. And so most children at the age of 7 usually have their 4 adult teeth in the front, 1, 2, 3, and 4, and on the bottom they have 1, 2, 3, and 4. What's normal is you're going to see some crowding on the top, you can have some spacing on the bottom, but for the most part we want the 4 teeth on the top, 4 teeth on the bottom, and then you'll have 6 baby teeth on the sides, 1, 2, 3, 1, 2, 3, so that's 6 on each side. And so that's really what's normal. And so when we start to look as children develop, they're going to go through a stage where they're going from baby teeth to adult teeth, and that's what's really captured by this x-ray. So when you come in at the age of 7 for your first orthodontic screening, one of the things that if your dentist or pediatric dentist hasn't done at this point is we take what we call a panoramic x-ray. And what this x-ray does is really start to identify whether your child has all their adult teeth present, and it also gives us an idea of whether there's excess crowding or anything abnormal at this age. And so what I wanted to do is kind of just highlight this, and at this age you can see that here's the child's 6-year molar, because children get their first molar when they're 6. This is their 12-year molar, and this tooth back here is their wisdom tooth. Here's the 4 adult teeth in the front that I talked about at the age of 7, 1, 2, 3, 4, and then 1, 2, 3, 4 on the bottom. And as you can see, the 4 adult teeth in the front and the 4 adult teeth on the bottom have enough space, and so we would say that this is a pretty normal x-ray. And as the child develops, as your child goes from the age of 7 to the age of 10, you can see the 6 baby teeth on the top here, and you can see the adult teeth following on the top. So that's what we look for. And so what we're really is making it an assessment, do you have all your adult teeth? Are there any teeth missing? And so this is a pretty normal x-ray. So what is not normal? So if that is normal, what is not normal? If your child has a relationship where you see excess spacing or the top teeth stick out to the bottom, that would be an indication of something that's not normal in a 7-year-old. If you saw your child have his upper teeth stuck behind the lower teeth, that would not be normal. And so these 2 conditions, one's called a class 2 condition, one's called a class 3, in more layman terms, overbite, underbite. So if your child exhibits those things or shows those things, those would be a concern for you that you would want to actually come in for an orthodontic screening. So in this relationship, I always tell parents, like in this situation, the top teeth stick out way in front of the bottom teeth. And as you can see in the x-ray, you can see how the top teeth stick out in the bottom teeth. So one of the x-rays that we use that's specific for us is we use this lateral x-ray, this x-ray of the head, to really determine the position of the upper teeth relative to the bottom teeth. And the combination of these 2 things allows us to determine whether your child needs any type of growth correction as they start to progress between the ages of 7 and 10. And so the other thing that we can see is you can also see how the upper jaw and the lower jaw, if the upper jaw is behind the lower jaw. And so a lot of these conditions that we just highlighted in these last 2 slides are things that we really get concerned about from a growth standpoint. And these are things that we want to address earlier than later. And the reason I say that is because if you remember in 2006, the TV show Extreme Makeover, Extreme Makeover was designed, or like the whole premise of the show was to make people look younger. And in that show, they also always used like surgery or used implants or cheek implants or Botox injections. Why? To try to make themselves look younger. And so some of these conditions that were treated with surgery on that TV show actually can be addressed and corrected early on by seeing an orthodontist when a child's 7 or 8. And so we can start to predict how a child's going to grow, and we can actually make a difference. Barbara Walters in The View, if you know that TV show The View, they did a segment during that time that showed that if a child was treated accordingly as the child was growing and before growing stopped, we could actually reverse or improve the conditions so children in the future would not need to have jaw surgery. And so those are two conditions that you have, the overbite and the underbite. One of the things that parents sometimes miss is sometimes what we have is what we call a functional shift, and what's where the top teeth are not in line with the center of the bottom teeth. And this is a result because of the top teeth being too narrow. And when the top teeth are too narrow, the child will then sometimes have an uncomfortable bite, and they'll shift their jaw to one side. So this is something that we really that's really important to correct early on and treat in a child's development. And so what we want, our goal is to have the top teeth and the bottom teeth aligned. So if your child exhibits this, if you take a look at them, this is something that's addressed early on at the age of 7 or 8. Now, sometimes you have medical problems, and this is where the combination of having your dentist and your orthodontist working together, sometimes people get trauma, and I know this is kind of a grotesque picture, but if you have a kid that plays sports and the teeth are pushed in, this is a child got hit with a baseball and the front teeth were moved in, so that's going to require some type of orthodontic movement in order to get the teeth back in the right position. The other thing that you want to look at is, and this is something that's so cutting edge, is that a lot of people have, you can see here, like there's a space or an opening between the teeth, and that's due to the tongue position. And so if your child exhibits mouth breathing, something where he or she always has their mouth open, that's something that actually we want to actually try to address and improve at this age. So a lot of times what will happen is you'll also get this what we call an open bite, and a lot of times is if the top teeth don't overlap the bottom teeth like this, your child will bring their tongue forward, and having their tongue forward in that space will always prevent the teeth from coming down and coming together properly. And as a result, your child won't be able to tear food correctly, and this could actually create a lot of problems for you. And it also can create a lot of speech problems. So if this is something that you see or you look at, this is something that's caused because the top teeth, right, are too narrow and the tongue doesn't have enough space, so we're going to want to widen or make room for the tongue, and we do that by using orthodontic treatment. Sometimes it's the opposite scenario, and this is something that a lot of parents always come into the office and say, oh, my child has a deep bite or an overbite, and what they're saying is that the top teeth overlap the bottom teeth too much. And so this is a condition that sometimes we treat early and sometimes we treat later. So it's really depending on what's happening with your child and what age they come in for their screening. What you want to notice here is anytime the top teeth are like this, positioned like this, there inevitably is going to be damage to the edges of the front teeth. And so that's something that we actually want to stop. And so this is something that's really, really important, because we don't want to have a child or, by the age of 15 or 16 have teeth that are worn down due to the fact that the overbite was never corrected. So sometimes you see this in your child. We call this an anterior crossbite. An anterior crossbite is where both of the front teeth are behind the lower teeth, and in some cases you'll actually only have one tooth. And one of the things that you want to see is when one tooth is stuck behind, it'll push this tooth out, and that's something that you actually want to reverse, okay? So if your child exhibits one of these two conditions, that would be a reason to have your child be screened at the age of 7. Sometimes we have, instead of an anterior crossbite, we have a posterior crossbite. And a posterior crossbite is where the top teeth are on the inside of the lower teeth, and you can see it in both directions here. Now in our office, because we use the Damon system, we don't use expanders, traditional expanders, to actually fix this. And so that creates a lot more comfort for patients. So I don't know if you've ever had you as an adult may have experienced adult treatment, orthodontic treatment when you were a child and you had an expander to make the top wider. I just want you to know that that's something, the technology is kind of improved and we don't use those in our office anymore. Whoops. The other thing that we want to also look at the age of 7 is this type of crowding. Sometimes you don't have enough room for your forward teeth in the front. And as a result, we want to actually get that corrected. And some of the reasons that people have crowding is sometimes children lose their baby teeth early. Sometimes they get decay and they get teeth taken out. Sometimes it's due to genetics. And sometimes it's what we call tooth size problems, meaning that the size of the teeth and the space that's available for them are inconsistent. And so what we want to do is actually create or fix that inconsistency. And so that's one issue. So crowding is another issue to bring in. And sometimes you have problems with the eruption of permanent teeth. And what we mean by that is some teeth actually will get stuck and we actually have to create space, maybe for this tooth here and this tooth here, so that that tooth actually has enough room to come down. And so that would be another indication of doing it. And sometimes kids just have aesthetic concerns, with issues of bullying. And so I know this from dealing with my kids, is that it's always, you always have to go through that psychosocial problem or aspects of school, because kids are kind of relentless, they're kind of mean with each other. And so sometimes even aesthetic concerns are some things that we want to correct. Some children will exhibit spacing. For me, spacing isn't as big of a concern in the early stages. I tend to let spacing issues kind of resolve themselves later in life, and we correct spacing issues, not necessarily when children have teeth that are baby teeth and permanent teeth. So we kind of hold off on issues of spacing. Spacings for me is not really an indication always to actually do early treatment on children. This is something that happens all the time. It's one of the most difficult things to deal with, is sometimes teeth that actually don't show up in the space that they're supposed to show up in. And so sometimes they're crossing each other. And you can see here in this picture, the front tooth is not down. This is a baby tooth, and the adult tooth isn't coming in yet, and it's all the way up here, and it's stuck behind another tooth. So you have an extra tooth, and you have this tooth, and so you have an abnormal eruption of teeth. And that would actually be another reason to have an orthodontic screening done at this age. Sometimes children are missing teeth, and you can see here's the two front teeth, and your child is missing the tooth next to the front tooth. And so that's another thing that we can address and kind of manage for you as the child is progressing from the age of 7 to the age of 12. And there's a certain protocol and a certain way we like to manage it in the office, and that's something we would share with you. Sometimes if you look here, you can see that this baby tooth, and this is the adult tooth, you can see how this baby tooth is almost stuck, and it looks like this tooth is erupting or coming out of this is sinking and this is going up. Well, in these situations, what we notice is that this baby tooth is ankylosed. What we mean by ankylosed is fused to the bone, so it's as though everything around it's growing except that tooth, and it looks like it's sinking. And so what we want to do is make sure that we deal with an ankylosed tooth properly at that age. So those are another concern that we have at this age. So doing early treatment, right? The rationale behind it is we're trying to make a difference in the outcome of patients. We're trying to make a difference by creating space for teeth, by addressing all the things that we were addressing. What we sometimes are able to accomplish is we can reduce the severity of treatment, which we can reduce having the need to take out teeth, adult teeth in the future. So a lot of things happen. So we're able to make growth corrections early on with early treatment. We're able to prevent children from needing extractions. And then sometimes we're just able to create a better prognosis for the gums in a child. And so these are all different rationales to actually doing early treatment. And so, again, sometimes we want to correct, another benefit is correcting thumb habits. And you can see when you have a thumb habit, the top teeth and the bottom teeth don't go together. You take the thumb habit out, and then top teeth and the bottom teeth will start to fit together better. Correction of an open bite, you can see the progression of doing early treatment. You go from here to there. And then sometimes you can see how people develop, and if we can get the top teeth ahead of the bottom teeth, the aesthetic concerns or how the children actually look will dramatically improve. So as your orthodontist, we're part of the dental team. We have a specific function that I think is so vital in managing the growth and development of your child, and doing an orthodontic screening early on in that, this whole paradigm is something that you should really consider doing. And again, if your child exhibits one of these types of conditions, then that would be something to have a conversation either with your dentist or come in and have a conversation with us. And so I really want to, again, highlight the whole team and our specific role, but I really appreciate your time. This has been a longer Friday Focus than we normally have, but it's been great. I hope you take away some great information, and we'll see you next week.